Hello, Molly.
Hello, how are you?
I'm fine. How are you?
I'm good. Are you getting me now?
Yeah, I'm getting you. Can I kindly see you?
Oh, you want to see me?
Yeah, I want to see the Shujaa that I'm talking to.
Okay.
Perfect. So today on the Voices of Shujaa, I'm with Molline Odero, a resilient mother living with the Willebrand Disease, right?
Yes.
Great. A rare bleeding disorder, often misunderstood and overlooked, but through her story, she sheds light on strength, advocacy, and motherhood in the face of chronic illness. Will you kindly, Molina, introduce yourself?
Okay, I'm Molline Odero, a mother with 2 children, married, of course, and I have von Willebrand disorder of blood.
Yeah, that's being a Shujaa. And I've seen that you're wearing a coat. What does it represent?
Yes, it represents me being in the healthcare sector.
That's great.
After the many struggles of having von Willebrand disorder of blood,
yeah,
I decided also to help others through making sure that I do a career that is in the healthcare sector.
That's great. You're truly being a hero.
Yeah, and also a counselor.
Great. I'm a counselor too. You're a counselor. So let's counsel each other so that we create change.
Yes.
Yeah. So when did you first knew that you had the von Willebrand disease?
Okay. I started bleeding when I was little, but at that time it was only nosebleeds. I would go in and out hospitals, being given blood, different managements of bleeding done. But when it made the healthcare workers do a diagnosis was in 2010, when me, my brother, my dad were all in Kenyatta National Hospital, is when I was diagnosed to have von Willebrand disorder of blood. Because at that time they had to query what is bringing the bleeding condition, because my brother had nosebleeds. My dad had his tooth removed and was bleeding too much.
Right. So what early challenges did you face?
The early challenges that I faced were being in and out the hospitals. I could not make ends meet with my education. Yes, afterwards I made it, but I was in and out school because I did not know how to manage my condition. That is, there were no factors by that time. I had not known that I have von Willebrand, so they would add me blood, and at times they would do different things like giving me transemic, management of the nosebleeds. I understand when unaekewa maji baridi hapa kwa kichwa, those things, but it could end up me being in an hospital admitted until when I was admitted for a longer period. When my menses started, now that was a challenge. So my menses started, and it could take, that was in Form 2. So that period also was a very big challenge, because I could even get my menses for more than 2 weeks, heavy. I'm using Pampers, you see. Yeah. So if it is pads, after every 1 hour, I'm changing my pads. So it was very difficult for me. That childhood period before I was diagnosed was hectic. And even after I was diagnosed with von Willebrand, before they started recognizing management of von Willebrand disease, at first they were only looking on Hemophilia A and B, which many boy child have. Yeah. But Willebrand, it affects women than men. So at that time, they were not checking in on von Willebrand as much. So when I started getting proper management was in 2016, is when I could be given fresh frozen plasma. Of course, at that 2010, I was given fresh frozen plasma. But at that time is when I started being engaged in these hemophilia groups. And also I could maybe go for fresh frozen plasma frequently when I had too much bleeds. But for me to get even a factor for von Willebrand, That was in 2020. Yes, 2020.
So it's been quite a journey, and you tackled through being a Shujaa. So you mentioned around high school, limited awareness, access to care. How did you advocate yourself to be a Shujaa, and now you are being resilient enough to share out your story?
At that point, I was very, when it comes to talking about menses, it's a private thing.
Yeah.
So when you want to share with people about I'm bleeding like this for this many days, it's really hectic. But I took a bold step when we had a first meeting. Jose Memorial Hemophilia Society had a launch.
Yeah.
Where there was this lady called Lori Kelly was coming. And being that we were invited as patients, my mom, my brother, and my mom were invited as a mother who has children with hemophilia, I went for the meeting. And because I was the only girl there, I talked with Lori myself and asked her about there in the US, are there ladies who have challenges with bleeding? And that's when he linked me. We talked, and after that, she gave me different books that I can read, a list of them. And also she linked me to a group called My Girls Blood, which is in the US. It's an online group. And the leader there was Cheryl D. Ambrosio, who made sure I went to World Federation of Hemophilia Conference, that is in 2016, in Orlando, Florida, where I got more enlightened about von Willebrand disorder of blood.
Perfect.
Yeah, so that's how. So that is how my journey through getting out of that fear of talking about von Willebrand, not feeling shy about me having a bleeding disorder, and I'm not seeing anyone else with it. That's how the fear went off. But I believe there are many outside there who still don't know about the bleeding condition, because even for the healthcare workers, it's only the facilities that I've worked in. I mentioned to them about it. But if you go to a different facility, which is not Kenyatta, Moi Referral, these other facilities, they'll ask, like, what is that? It's something that we've not had. Yeah. So there is a journey and some things that have been done, but we still have more to do as the advocate. I believe you're one of them. So don't advocate only for hemophilia, but for von Willebrand too. Women bleed too.
That's how I'm trying to connect people that at least are being bold enough to share their story. You being one of them, you're a Shujaa, you empower me. Since we met at Kisumu, right now I feel empowered that at least you say that you came out of that and you're now bold enough to create awareness. And thank you for that. So living as a mother with that health condition, managing daily life, pregnancy, and raising a child while living with the von Willebrand disease, what does it mean to be both a mother and a patient living with a blood disorder?
Well, that is another big challenge.
Yeah.
During my, when you're a youth, there are certain expectations of getting somebody to marry you, a boyfriend. But there are some things you cannot live without mentioning when you get a relationship. Yeah. So when you tell somebody, I have a bleeding condition, the first thing that clicks into his mind is about sickle cell. So when you talk about it, they think of sickle cell and they don't want to engage with you. You keep them in and out hospital, because sickle cell is much known than von Willebrand. So they assume. So I had very many trial relationships which didn't work.
Success
and that made me married at a very at 29 years of age. That is when I got married. my relationship started there at 26, yeah. And before he really settled down that now it's you, it took time. So after marriage, there is this thing that you have to get children. And for a person with Willebrand, it's also a challenge. Number one, you think of, will I deliver a child with von Willebrand too? Number two, will this pregnancy stick for the months that is required?
Yeah.
Number three, will I carry this pregnancy to term? And true to the word, yes, I got a husband with understanding, and life started. I got pregnancy the first time. I had to quit my job because of the challenges. You have pregnancy, you're bleeding. Period. That was a challenge. Another thing, when it reached around approaching 7 months,
yeah,
I had to deliver because of the bleed I had. I had to be admitted, and at that time, of course, they could not do CS because Professor Manda, who was dealing with hemophilia at that time, was not around at Kenyatta. So they did other means of making sure the baby is out. So I had to stay in the hospital for a longer period when they were managing the bleeding.
Yeah,
I stayed for long because of fear of what will happen if I get a second pregnancy, and leave alone what will happen. Will it stick? I tried, yes, but I got it after 7 years. So I got it. It was also a challenge. You are in and out hemophilia clinic. You are in and out gynecological clinic, and luckily enough, I survived the pregnancy. The 2 boys are very okay. The first one was tested. He doesn't have von Willebrand disorder of blood. The second one, we are still waiting for the test.
Okay.
Yeah.
You're truly an empowering woman, and you at least create that environment for them to feel safe and feel that they have someone to look up to. So overcoming the barriers and advocacy, where now you went to Jose Memorial. What did you learn from Jose Memorial, and now that you can use to advocate?
Okay, at that point, I learned that people are out here suffering because of lack of knowledge. Yeah. And that is when people are asking, I've been like this and like this. Kumbe, I should tell this person also to come and get checked up because of hemophilia. And there is that person who even keeping on going to the facilities for treatment or care and treatment for hemophilia is hard. So what they could manage is just visiting these small clinics which were not helping. So I learned that there is still much work to do when it comes to advocacy. Yeah. Yes, Kenya Hemophilia Organization has done much because of opening the clinic, but we are still very far. So I just request for the people who can support us to continue supporting, and for us who can do advocacy, we continue advocating for other people to be aware about it and also to get help early. Like for me, I think it's only God's mercy, because for you to come out from being born in 1980s, then you know your status in your diagnosis comes in 2010. You can imagine suffering for that long.
Yeah.
So let's just keep on. I keep on doing the advocacy. I believe funds could. I request that, or do wish that funds could be there for organizations like Kenya Hemophilia Association to do advocacy even in all healthcare systems, clinics, starting from the clinics, not only these big facilities, starting from the clinics, in schools, because their children suffering. The teachers are aware of their bleeds. The parents might not be keen, but diagnosis has not been done. Even in schools, this could be done, and at least awareness could go on. Yeah. When it comes to management, I would wish the government to consider us, because we are suffering too much. We are in and out hospitals. We have to pay something to be attended to. Yeah. So when it comes to paying that much, and you have other things to take care of, and maybe that person even doesn't have a job. For example, me, I have something small, but being that you have other things to take care of, this money is not even enough. At times, even for me, personally, as I'm speaking here, yeah, I am told to go to clinic at this point, but I don't go. Why? Because I know my factor is not there. I'll go and to see the clinician, I have to pay something. So why should I go? I just look for other management things. At least me, I'm aware of what is going on and how I can take care of myself. But what about that person who cannot take care of herself or himself? Yeah.
We really need support. Yeah. Our voices, whatever that we do, we need to at least make them happen, to push the government, to push the organization that are already there to make change. Some funds are there, but
yes,
atusaidiwe tunafaa kusaidiwa.
Yes, true.
So what motivated you to speak about the Willebrand disease?
What motivated me is that when I went for the launch at Jose Memorial Hemophilia Society, I saw other two ladies who were diagnosed at that time with von Willebrand's. One is still there, rarely talks about it. The other one, I've never seen her again. Normally, when I go at Kenyatta, I ask for even other people who are other ladies who have been diagnosed with von Willebrand's disorder, so that we could at least talk. But even if I call them, I've never met them to sincerely talk and even do that awareness for them also to be able to speak out like I'm doing right now. Yeah. So, and I cannot blame them because even for me, it took a lot of work and energy, and just coming out to talk about it. Yeah. So I that is how my steps of coming out came. I saw the suffering I was undergoing. Even my brother at that time, the suffering he was undergoing. Yeah. And because I survived, survived death during this period that I was bleeding. That's why I say that I must help somebody. Because reaching this age that I've reached with bleeding, and like for now, we are like more than 8 months without factor. Really? And I delivered without factor. Yeah. If it is not Dr. Kibet who intervened, calling those people and directing them of what to do, where do you think I could have been?
It could be something else.
Because Dr. Kibet was there and I had his number.
Yeah.
You see? But what about that person who has no other different means of consultations? It could have been very hard.
Yeah, sure.
Yeah. Mm.
What change do you hope to see for the women and mothers like you?
Mm-hmm. The change I would like to see is having a team that could help in speaking out about von Willebrand's. Yeah. Being able to come out and speak about menses. People, I know people have kept quiet because talking about menses is very critical. Because for us women, previously when I had no menses, I could say it's no splits. But now it's no splits and menses. The menses can be longer. At times I change pads for even every 1 hour. Yeah, the normal parts at times I cannot use it. I use this one called endosum, which is a little bit heavier. At times it's too much until I just want to have a pamper. so that I could manage myself amongst people. You see, so it is very shameful talking about such things, and that's why I know people are not coming out. But I would say, come out from there. Don't sit. Help others so that we can fight and help others. Make sure that they at least have life. Yeah. Yes.
All right. You spared Masingugi here, and she has a question for you.
I'm getting it. Somebody, I saw something.
Yeah, it was a question.
The question is
what
from
Masingugi.
Uh-huh.
What I understand as hemophilia is acquired from mother to son. What about the Willebrand disease, Molline? If you get a girl, can she have some condition as yours?
I remember mentioning that even when I was delivering the two boys, because I was told I could have a carrier, I could have a girl who has the condition. Yeah. So my fears were that this boy can be a carrier, as my brother has von Willebrand. My dad has von Willebrand. My grandma had von Willebrand. So it's only that for my father and my brother, it doesn't come out that much because they only do nosebleed. It doesn't affect their joints like hemophilia A and B. But for me, it portrays more because it's von Willebrand. Yeah, so you see that biological, whatever, the doctors can, the hematologist can explain much better. But I also have those fears. And that's why even reaching number 2 is a great, I've tried. Yeah.
You're truly becoming a teacher, and you'll ignite hope somewhere with your story, and you pushing out for change, it will create change.
Yes, I believe so, and I have faith that it will. Yeah,
it will. As long as we raise our voices, it will.
Yeah.
So I hope Mercy's question is answered. And what message will you give to women who may be suffering silently without undiagnosed bleeding disorders?
If you have any bleeding condition, kindly, I would request all women with any bleeding condition that you see has symptoms that I've mentioned, kindly seek medical assistance. Don't just keep quiet. It might cost your life, your child's life, and it is something that will be helped. We are here. I'm here. I've been there. I've been bleeding. I've had von Willebrand disorder of blood. But since I knew from that time that I was diagnosed about it, at least I've managed to take care of myself. The doctors have managed to help me in taking care of myself. So I believe that if you come out and visit the healthcare facilities for assistance, you'll get the assistance and diagnosis will be done. So don't just keep quiet, get out there and get the correct diagnosis. And if it is, because it doesn't mean that if you are bleeding, you have von Willebrand disease. It only, if you are bleeding and you go to the hospital, is when you can know this is von Willebrand, this is what and what. You cannot just sit down and wait and say that, for example, for me at the first steps, I was being told that I'm bewitched. Later enough is when I know that I have von Willebrand. So don't just sit there. People are telling me you are bewitched, it's a gynecological problem, and you've not gone for that checkup or test to know what is going on in your body. Yeah.
Great, Shujaa. If someone wants to create impact through your story, and as an advocate, where can I reach you so that we create more impact? If you are raising awareness through platforms, maybe.
I believe my stories are out there in health diaries. But I can also give my number. I can help with reaching out to the nearest facilities like Kenya Hemophilia Society, where tests can be done and you know your bleeding condition. Meanwhile, I have not even opened a YouTube channel, but you can have my number. My number is 0726 764 768. 0726 764 768. My Facebook account is still Molline Odero. My stories are also there. So don't feel shy to reach me.
Perfect. Let's create change together. And Molline's story reminds us that advocacy starts with one voice. Looking forward to create change with you. Moving forward, and hivi karibuni, we'll want to at least talk more something about what created or what impacted your life, so that we want to create change in this society. A voice of courage, a voice of care, and a voice of Shujaa. Thank you, and say hello to my Shujaas at home. God bless you. Thank you.
I'll tell them.
Okay.
Yeah. They're all protecting me also.
Okay, thank you.
Thank you.
Good evening too.